hypertension is the leading cause of stroke and it vastly affects the cerebral blood flow. Antihypertensive treatments, they benefit the cerebrovascular health and even the cognitive function in such patients, but it is quite uncertain whether an intensive blood pressure target leads to potentially harmful cerebral hypoperfusion, condition where there is a decrease in the blood pressure or even the cardiac output. Hello and welcome to Medical Dialogues, your daily dose of health and medical news. I am Dr. Nandita Mohan. Intensive blood pressure control associated with cerebral blood flow. The association of intensive systolic blood pressure control versus the standard control with the whole brain cerebral blood flow was investigated by a study that was recently published in the JAMA Neurology, wherein the study found that intensive versus standard antihypertensive treatment was associated with increased rather than decreased cerebral perfusion, most notably in participants with a history of cardiovascular diseases. Restoring sinus rhythm to reverse cardiac remodeling and reduce valvular regurgitation in AF patients. Cardiac chamber remodeling in atrial fibrillation reflects the progression of the cardiac rhythm and may even affect the functional regurgitation capacity. Now, a study aimed to explore the three-dimensional echocardiographic variables of cardiac activity remodeling and the impact on functional regurgitation in patients with atrial fibrillation with or without a sinus rhythm restoration at 12 months period. The study highlighted that the management of atrial fibrillation should focus on restoration of sinus rhythm to induce anatomical and functional cardiac activity reverse remodeling and reduce the severity of functional regurgitation. Link between LDL cholesterol lowering by statins and CVD reduction not consistent. Statins are now commonly, very routinely prescribed by doctors, with 1/3 of adults over the age of 50 taking statin therapy. This is according to previous research. Now, the new findings in the Journal of American Medical Association contradicts this theory, finding that this relationship was not as strong as previously thought. Instead, the research did demonstrate that lowering LDL cholesterol using statins had an inconsistent and inconclusive impact on cardiovascular disease outcomes such as myocardial infarction, stroke, and even the all-cause mortality. The researchers later on went on to suggest that this updated information should be communicated to patients through informed clinical decision making and updated clinical guidelines and policies. Do pets have a positive effect on your brain health? Pets are nowadays being considered as a part of our family. The human-animal bond is a mutually beneficial and dynamic relationship between people and animals, which is influenced always by positive vibes. Owning a pet like a dog or a cat, especially for 5 years or longer, may be linked to slower cognitive decline in older adults. This is as per a preliminary study release that will be presented at the American Academy of Neurology's 74th annual meeting. As stress can negatively affect the cognitive function, the potential stress buffering effects of pet ownership could provide a plausible reason according to the study findings. The companion animal can also increase the physical activity, which could benefit the cognitive health. Hence, it is observed that having pets at home does have a wonderful impact on the family members. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.